Welcome to EAC Speaks, the podcast where we dive deep into the movement to end the HIV epidemic right here in the heart of the South, Arkansas. I'm your host, Eddie Wiley, and together we're going to explore the stories, insights, and passion that fuels engaging Arkansas community's mission. Join us on this journey as we unite voices and take meaningful steps toward a world free of HIV stigma. Now, get ready for a conversation that matters. This is EAC Speaks. Welcome to EAC Speaks. I'm your host, Eddie, and this is the show where we dive deep into the conversations that matter in public health, community advocacy, and prevention education. Today, we're thrilled to welcome Amber Kincade, a passionate health advocate dedicated to making STI prevention, PrEP education, and community care more accessible. With a background in linguistics, health promotion, and years of hands-on experience working with unhoused communities, Amber brings a unique perspective to the intersection of education and empowerment. Now, in this episode, we're going to explore the realities of PrEP access, the power of community-based health initiatives, and the challenges and triumphs of working in public health. So whether you're an advocate, a healthcare provider, or just somebody that's curious about building healthier, more informed communities, this conversation is for you. So let's get started. Welcome to EAC Speaks, Amber.
Hi, thank you for that introduction. I feel like I just graduated. I appreciate that.
Of course. So can you tell me and the listeners, viewers, a little bit more about yourself?
Yeah, so you lined it up pretty well. Multidisciplinary. I consider myself a professional citizen. I happen to get paid for it when I have a job, but I'm still out doing similar tasks regardless of, what I'm employed to do. And yeah, I really got into health advocacy and kind of more of like an overarching prevention because that's just where I saw the need. I started off in harm reduction. And so that's like a heavy need that's very stigmatized. And so even from there, I was able to see the other health barriers that people with substance use issues were facing. And so it just felt very natural to just kind of tap into like, okay, we obviously need to up awareness, knowledge, and access. And I'm here. People like me. People like to be around me. Clients love me. Always a kiki. So it just felt very natural to kind of bring together everything that I've learned. Like with the linguistics, it's like, okay, I understand communication really well. I can peep when someone's uncomfortable or when a situation's not very safe or those little nuances. And then I'm able to bring together my lived experience, being in America, being Black, being queer, not making a ton of money my whole life, where I just bring that kind of authenticity to the work. And I think people really resonate with that because there's really no bells and whistles for me. Like, I'm not going to dismiss anybody's reality. You won't find me telling you, oh, it's not that bad, or it's not that serious, or that didn't really happen, or you should try again, with like no context. So I consider myself a very personable, like, public health know-it-all. I don't know.
That's cool. So have you always been like that involved in like service? Because it seems like a long time of like being of service to folks.
Yes, for sure. So I grew up in the South. I guess not everyone in the South went to church. I grew up in the South and went to church. And so I was deeply involved in terms of church life. So I was always kind of out and about with community members, tapping into something even through childhood. It wasn't so directed then because I kind of had to be there, but just to say that that's where I really got comfortable with people, I think. Like that's where I kind of was able to, like when I talk to folks, especially in the South, like I see congregation members, I see my grandma's like peers and community ATs and stuff. So like I'm able to get past a lot of, that the biases we all have and the uncertainty of how to talk to people and how to broach certain topics. And so I feel like my commitment to like service and being around other folks really started with that upbringing. I'm not church affiliated any longer. So once I got out into the world and developed my own belief system and figured out what was going on, I got really into social justice. And so I did some activism and organizing in college. I found that to be very exhausting. Especially organizing. I think people think it's just rallies and photo ops. No, you're working for free. You're working for free. You are working for free, and you're trying to convince people who are dealing with like profound apathy and distrust of the system just to show up to like a think tank meeting, and you can't compensate them and you can't fix the issues they're facing, and there's no other support you can do. And so I found organizing to not really be fulfilling for me. Um, but to say that also kind of primed me to go into health with the social justice perspective, because what I saw from jump was that apathy and distrust are major barriers to everything.
Mm-hmm.
Why don't people do this? Why don't people do this? Apathy runs deep. Sometimes it's historical, generational, like with Black folks, like with Native folks who have been subjected to, medical nonsense, being sterilized against our will, things like that. Who am I to tell someone, oh, don't worry about that. That was way back then, or people who have substance use challenges, living with addiction. A lot of times people will it's all in their face when they see people they think are druggies or junkies or unworthy. And you experience that one or two times, you're not going anywhere where medical professionals are. You don't care what they're talking about. And so coming from the social justice perspective, I was able to tap into that apathy and understanding that, like, hey, people who smoke cigarettes know that cigarettes are dangerous, right?
Mm-hmm.
Like you probably will not find a smoking adult who is not aware that it can cause 30,000 kinds of cancers, and it can mess up your respiratory health, and it can do this and do this and do this. So what's the issue?
Mm-hmm.
Apathy. It's a complex, compounded situation where we got childhood trauma, regular everyday trauma, socioeconomic instability, all these things stacking up on each other. So it's not that the person doesn't want to be healthy, doesn't like themselves, doesn't want to prioritize their health. A lot of times there's no space to do that in their mind. Like, where do they put that? And what do they replace the smoking with?
Can I tell you this? This is so, I'm gonna get back on track, right? But I want to get off for a little bit because this is so similar. Family was my first community, I guess you could say. Church was absolutely that next community that I knew, like outside of like family. So that's also where I learned service as well. We didn't do as much as I thought we should do as a missionary Baptist church. But I always question, like, why aren't we doing like toy drives, coat drives, and all of that stuff? And that's kind of small scale, but I was a kid, so small brain, like,
that's dreaming big for a baby. Yeah.
I absolutely thought we should be doing things. And then I continued things, and it was college where I learned social justice. I went to Philander Smith, a social justice institute. So I learned the ins and outs of organizing. And I was like, oh, hell. I was trying to do this, so I thought I could like set up a rally, set up a town.
Y'all got
it. And I said, oh, yeah. After like my 5th or 6th, I worked on a campaign, Go Heal. And I was like, oh, no, I don't want to do this full time. Shout out to all of y'all. I will help do the signs. I'll do the signs.
Yes. Child care. You got kids? Bring them over here. Y'all do y'all thing. We're going to go build a mud pile. I found ways to be in community and of a service without putting my sanity on the line.
Yes, because I'm not planning on that stuff. But yes. Okay, so back to you. So working in such a complex system anyway, of public health, of prevention, working with unhoused communities, harm reduction, what is the importance of having such a full-bodied background? Because we know that people aren't a monolith and people don't work in one way. So how do you use that in your approach?
Well, I do want to say first, it took me a long time to respect that about myself and like that about myself, because there's really not room for it. There's not a lot of room for multidisciplinary applications, especially if you're, young 30s, late 20s. They're looking at you like, well, are you really good at it? Like, if you haven't committed 6 years to this one field or discipline or topic, is it really important? And so for a long time I felt, like I was messed up. Like I was just, oh, you just can't decide. You can't settle on anything. You just need to pick something and find your niche. And meanwhile, like I knew intuitively that like, that doesn't make any sense. Like studying language and then studying health shouldn't be contradictory. And so for one, I just didn't like it for a long time. And now I'm really confident in it because I just see how it works when I meet people, being able to I say that I have survival Spanish skills, as in I myself will be cool in a Spanish speaking environment. I maybe shouldn't be a medical interpreter, right? So, but having just a little bit of Spanish when you have clients who speak Spanish, even if you're not going to be the interpreter, being able to hit them with a little "Hola, what's up? How can I help you?"
Mm-hmm.
It it brings like their insecurity and fear and nervousness down, and then coming in with the work from street outreach. That's one of my favorite things to do. It's one of the most poorly paid positions in the work, and it sucks because it's my favorite part. I just want to be outside talking to people, giving people stuff. Coming in with that experience has allowed me to be like flexible and adaptable in really complex environments, which includes with unhoused communities, with people who maybe are actively on a substance. When you talk to them, having finding all the space in my mind to be like, okay, this is what I'm here for. This is what I actually can accomplish. And I can't make anybody I meet do something. Right. So I don't go in thinking I need to save everybody in here. I really rely on those communication skills that I've learned through linguistics and I learned through just interacting with people. And I think it's really important to have multiple pieces, just because everything's just not what it seems. I think it's really important to remain open, to just what's happening in any given kind of situation. I think I add a lot of valuable insight in terms of how we communicate with unhoused folks, people who are just really down and out socioeconomically. Um, I've had people question like, how do we do it? What are the things we should say? And in my mind, I'm like, I just know how to talk to poor people because I'm poor, and being poor is complex.
Yeah.
Being poor requires to have a handle on day-to-day activities, managing your home, managing your life, your children. You have to go like be in a professional world where your experience maybe isn't respected. Maybe you don't have credentials, you don't have a degree or something, but you know what you're doing. You have deep experience, and you have to go navigate in a professional world that does not care, that does not want to compensate you for that. So I think being multidisciplinary, having your hands in a few different pots, allows you to capture more people and just be more authentic. Because a lot of people out there are not one trick ponies themselves. I rarely meet anyone who truly just does one thing. Like,
Yeah.
come on, y'all got hobbies. Y'all have some prizes somewhere.
Yeah.
Yeah.
I think for me, I look at the whole thing similar to you of it's not just one thing. I have to think the layers of what's
Mhm.
happening, whether it's in my messaging. So even coming from street outreach, yes, God is one of the poorest paid positions.
Yeah.
And I really struggle with this a lot sometimes because working in consulting, this is like the most money I've ever made. But then I look at it, trainings that are being developed, TA that's being delivered, and a lot of them have never been on the street. A lot of them have not, and I don't mean like live on the street. I mean like at least being outside talking to people who have had to, who are unhoused. And so I think that is a really, I don't know. I also agree with that because people are amazed sometimes, and I'm like, they're like, how do you talk to such and such? And I'm like, Eh,
Just
maybe
tell
because
me.
I was there, and maybe because they're just a person. Like you don't have to like.
Right.
There's
It's not
no vernacular to say like, let me open a dictionary to speak to this person, depending on their
right.
whether they're unhoused, whether they're black, whether they're
Hmm.
on substances, whether whatever it is. I just think people have to have and looking in self. So a lot of times people don't internally like look internally to say, I am more than this role. So I can
Right.
do more in what I'm doing. So how you have
Hmm.
your linguistics experience, I see that in a lot of ways. I see that in dissemination teams and communication teams
Hmm.
and communities of practice. So I love that you're forging your own path.
Thank you so much. I
So
really
let's talk
appreciate
about
it.
prep. So let's talk about prep because we're gonna talk about the
Yes.
program. For people who may not know, we've talked about prep before, but I
Mhm.
want you to tell us what prep is and who do you think should be consider using it.
Yes. So my favorite tagline for PrEP is PrEP allows people who are HIV negative to stay HIV negative. It's a pill or injection or There's pill injection. Oh, the vaginal ring. Sorry, I always forget that one. That you can take, because you can't take a vaginal ring, but at the required intervals to stay HIV negative, to not contract HIV. As far as who it's good for, I do think about this a lot. It's part of what I provide in like prevention counseling. So if someone's abstinent, that's probably not a great candidate for PrEP. It's not a zero chance, but it's like, well, if you're not having sex and you're not using injection drugs, you're essentially not at risk for HIV outside of acts of God. So that's probably not the best candidate. But someone who maybe has multiple partners, maybe has changing partners throughout the year, someone who does sex work, someone who is an injection drug user or is maybe dating someone who's an injection drug user. I see that in harm reduction, of course. You have people at different degrees of their recovery, and it's very complicated. AA, all of them say, cut it off, cut them off, cut them off. But for a lot of folks in recovery, their partner is the only reason they're alive. Mm-hmm. So it's impossible for them to cut them off. So people who may be at risk of injection related transference. But yeah, just really try to discuss it in terms of risk. It's not advised as like a lifetime medication. It's not like get on PrEP and never quit. It's very specifically about those risk factors. And so something I find important in my applications of public health is teaching people like personal risk assessment, because that's your life. That's your life. You got to be able to assess, okay, I don't have a one main squeeze partner right now. I'm dating different people. I don't always ask about their status. I don't always use a condom. Like, okay, cover your bases so you can go move freely. Like, you're doing it anyway, but you're doing it with a ton of anxiety.
Yes.
Feel deeply anxious. You're not having a joyful time. Don't try to lie to me. You're unhappy with this situation.
Like, be honest. We can be honest here. I'm here to help you.
It is. Yes, I really am proud that like I got rid of any residual savior complex issues that I might have taken out of teenagehood and young adulthood, where you're very hormonal and passionate. Yeah, trust me.
I used to be so like, oh, let me just do this for you. Right. I'm just like, well, look, let's find a way.
Yeah, I'm not the HIV prevention fairy. I'm not going to pop up on your shoulder for the rest of your life and remind you of anything. Let's get PrEP. Let that be your prevention fairy who's on your shoulder, because I can't call you every day. I cannot track you every day. I cannot come inspire you every day and motivate you every day. At some point, I got to let you go. You got to decide what's going to work for you. So
that's so funny. People used to hit me up all the time. I'm sorry to interject,
but you're fine.
I felt like, how Glenda pops in her bubble. When they would call, I felt like I was always in their house. They would be like, I think I got I got somebody coming up. I think I need to. I'm like, wait a minute. Like, can you not call me right before you're about to do what you do? Just think what I was saying.
Are you listening to me when I speak?
Why do I have to say it again? I'm writing it down for you.
Right.
So, tell me this, Amber. People who are involved in community-based education, folks as in us as service providers, what is one thing that you have to say to them about handling folks who have a serious, I won't even say serious, have something going on outside of just coming in to get tested? Like, what do you say to providers when there is a thing like an unhoused or substance?
Ooh, so that's multi-level, but that is my specialty, multi-risk environments. That's mostly what I have dealt with. Like people who come in, like, I want clean needles, but also I'm unhoused and somebody just trashed my camp last week. And also I was assaulted yesterday. And it's like, okay, let's run this back. Let's figure out and assess. So one, if you are employed, make sure you're minding your lane of what you do in your work, because we as community service providers, health workers, we want to do it all. And so like for me, depending on the situation, like if someone's trying to get on PrEP, actually, this is a good case study. So someone was trying to get on PrEP and they're unhoused, and need treatment for another situation, and also possibly need some residential recovery housing, right? And so in the scope of that, unfortunately, PrEP was not my number one issue, right? PrEP was going to require adherence. PrEP is going to require telehealth appointments, turning in either at home kits or going to get blood work drawn. If you don't have transportation, housing, or a working phone number, that's a huge burden for what is essentially to that person, not to public health specialists, but to that person, it's like a tertiary problem to them. Their most immediate issue probably is housing, right? But within my role as like a PrEP navigator and health worker, I have no pull over housing. I can't make housing pop out of the ground. And I have a lot of lived experience navigating social services and welfare. So the best way I can advise people is to get familiar with what is available, because a lot of people get handed the same list of like 5 places who allegedly do XYZ. And then they show up and it's like, okay, no substance use problems. You can't stay here if you have substance use issues. You can't stay here if you have a severe mental health diagnosis. If you have schizophrenia, no, you're considered objectively dangerous. You can't stay in shelters generally. So when you're getting handed this list from a bunch of professionals that you've been handed 7 other times, and you're looking at them like, yeah, they hate me. They won't let me come over there. What I think a lot of providers are afraid of is not having an answer. Whereas I think I've noticed people really appreciate when my answer is, hey, really sorry about all this. Here's what's actually available. Here's the likelihood of getting a hold of these people. These people can help you if you agree to be sober yesterday. You know? And so that doesn't solve their problem. It doesn't necessarily put something in their hand. It may not even like substantially change the circumstances they came in with, but I'm not handing them that list again. I'm not handing them the list and doing a cold, handoff. Hey, sorry, this doesn't seem like the best time for this. It's like, this is what's available and this is what I think would be very important. So if someone got some really serious substance use, I hate to say issues because issues is
Yeah, I hate using that word. I need to find a new word.
it's hard. It's not our fault. It's the medical industrial complex. They made us say it. They called it mental health issues, and we said, yeah, that's cool. But then on reflection, we're like, maybe not issues. Issues is more of like, oh, she has issues. They have issues. That's her personal issues. Like
when I said it, when it came out, I was like, damn.
Yeah, mental health experiences also seems too broad. So diagnoses, conditions, but if you're dealing with substance use and it is disordering your life, causing dysregulation, you can't work, okay?
That's my disorder. Give the time.
Right. I would want to broach that first. And so it really takes like a case by case assessment of what would be best right now. Yeah, I would love for this person to be on PrEP. This person should be on PrEP. This person also needs treatment for a whole other situation right now. That's like, go get that handled, please. Yeah, PrEP is important, but go get an active infection treated, right? And so I think a lot of people who don't have that lived experience working with what I consider poor folks, the undesirables, the unmentionables, whatever name we're giving everyone who's not getting care this year, they're scared to say no and are scared to not have the answer. Whereas I have the lived experience of not having the answer. I'm not afraid to say I don't have the answer. Yeah, that's life. A lot of us don't have the answer.
Right.
But I do
have. That made me feel better.
You say what?
When someone tells me that they may not know, like a provider may say, like, I don't know, or let me help. Let me find someone who does. It at least gives me a little pause to say, okay, I'm not alone. So I'm not the only one that doesn't know this. So even though it may not be in every situation, but I think it's just great to be honest with people and not put on. Like, I think that's the hardest thing that I used to do, of like always wanting to have an answer, always wanting to be right, always wanting to save people. So that was a big switch of like, just like what you said, of moving from that savior to I'm verbing this allyship at this point. So I'm not here to like move you into it. I'm here to like verb you in as an ally.
Yes, I have resources, I have choices, I have options, I have different perspectives. I am not going to drag you by your ankles to do anything. We got to collaborate based on what is suitable for you, what's most achievable for you.
Absolutely. Now I want to learn more about your prep ambassador program. Is it a program or training? What are you calling it?
I'm calling it a program, but it is a training. But yeah,
Okay.
program. I guess it's going to start with the training, but it's building a program effectively.
Gotcha.
So what it is an evidence-based curriculum that's actually partially supported by USAID and PEPFAR, which, politics aside,
I got a headache now, Amber. Okay.
it is evidence-based. That's the point I want to rely on, is that this is updated evidence-based curriculum. They have two different versions, one that's for diverse populations, but I'm rolling my eyes because of the politics, not because I'm annoyed with diverse people. And then another one, I mean, I'm annoyed of being made aware, honestly. Like, okay, we're diverse, please. Enough.
Leave me alone, please. Leave me alone.
Please. I'm literally just talking to everybody else. So there's one curriculum that's targeted for diverse populations in general, and then the other one is for adolescent girls and young women, because of course that is a population who is not getting on PrEP because of the stigma around HIV as still being a gay disease, a gay promiscuous problem, and not just like a sexual health risk that comes with having sex, right? And so what we're doing is we're going to train 10 people to be a PrEP ambassador. They're going to get educated on HIV prevention. We're going to touch on gender-based violence and human rights, because this curriculum was actually designed across multiple countries in Africa, South Africa, and Zimbabwe, most notably. And so the curriculum was designed with those populations in mind. And so the gender-based violence situation, of course, across Africa is very different than what it looks like in the US. Obviously, we have a lot of out loud gender-based violence here. It's just a different dynamic. I don't want to get too much into it and start misspeaking, but just to say it's coming out of a different cultural environment. And so I did want to maintain authenticity to that point, just as like a shout out, like to our folks doing HIV prevention in Africa. Like this was an important part for y'all, and it's an important part for us. So I want to maintain the parts about violence and stigma. Then, of course, we'll go into all the PrEP versions that we have: oral PrEP, the injectable PrEP, and the vaginal ring. Who should have it, who shouldn't have it, right? Like cis women cannot take Descovy. The vaginal method is localized, so that's preventing in the vagina. It's not going to prevent in an oral situation. So they're going to know all of that information. Then they'll get skills on how to be an ambassador, which will really focus on peer support, self-care, boundaries, how to manage like disclosures of violence if someone's coming to them with something along those lines. And then after that, they'll be an ambassador for EAC, a PrEP ambassador. They'll be able to earn referrals, like a little extra income, for referring people to PrEP successfully, which includes them getting their medication. And my vision for that, right, is we're dealing with that apathy and distrust. That's going to be cut through quickest through relationship building. Apathy is deep, it's profound. They don't need more information and awareness in that way. They don't want a pamphlet, they want connection. So the ambassador program allows EAC to get a further reach. It empowers community members, people with lived experience. And it's just working smarter instead of harder for me.
Absolutely.
Yeah.
That is brilliant. I think that this program will be highly beneficial for Arkansas and to set the blueprint for folks across the world, because there are other PrEP ambassador programs, but I don't know too many that have someone as intentional as you seem to be when it comes to actually connecting with the community, and thinking about even income for folks, because reading is fundamental. My ass looked and I said $50, but it's $50 per.
Yes. Yes. And then an added benefit too, this is beneficial for me as a professional, is that once they're successful, like the follow-up support and kind of mentorship I get to provide. So it's not just like go fly, use your own skills and 2 feet to go figure this out. I'm also going to be helping facilitate and find opportunities for folks to go speak or to, show up and do education and be in connection with them. So they're like, oh, hey, my auntie is a high school teacher. She wants me to come speak about PrEP. I can get you materials and come with you, or do coaching on how to do public speaking or whatever. So that full connection, not just sending folks out and being like, okay, you learned it, bye, get your little continuing education credits and off you go, but really nurturing the relationship and helping people feel truly empowered in the skills they've learned. It's not for nothing. It's not in vain. It's absolutely valuable.
That's exactly what I was going to ask you. And you hit the nail. Can we still say it? You can hit the nail on the head.
Right? Are there any words in there?
Like, damn. But yes, I think that's really important for folks to understand that, yes, this is a program, but you get more. There are a network. I think about conferences. We used to do this too for our ambassadors. We would help them write their scholarship applications and all of that. So that's really, really cool. A lot of people just do their prep ambassador program, do it, and be on
They maybe have a front end stipend. I did do some research on some other models. One had like a nice big stipend to plan a whole program. And I was like, yeah, that would be nice. But like, where are they? Are they currently empowered a year after? I was thinking about how to navigate that. So
yeah. And I even see like expanding it from that the first cohort.
So yeah, this would be a pilot, right? So
hey, look, I'm not gonna push myself on you, but let me know whatever you need.
Yeah,
I'm here to support as well. So if you need anything, you know how to reach me. But yeah,
will.
So what qualities are you? I'm gonna say qualities you're looking for. What will make a good candidate for the program?
Yes. So I purposely did not narrow it down too much. I didn't say we're looking for target groups at risk yet. I said anyone is welcome to apply as long as you're above 18, because I don't want to deal with parents in this climate for the pilot program. Let me test it out first before we open that up. So anyone 18 and up, you can be someone who's interested in health, community health, health promotion, medical sciences, social work, or someone who's just a community member who's motivated for community. Like this would be something that I would look at as an opportunity, particularly in my 20s, just because as you get older, there's just certain opportunities you can't always take. But to say it's open to anybody, including middle career health professionals, because what I think is really valuable about this, and it's kind of just me being joyful about life. Everyone doesn't mirror this, but what I feel is really cool about this is that PrEP, HIV prevention, sexual health, substance use prevention, these are huge black holes in research and medical sciences. The doctors don't get it. They're not doing street outreach. The nurses don't get it. Like this is knowledge even medical professionals don't have, babe. Like we just now, in the past 10 years have been able to get providers who do PrEP, who understand what PrEP is and are comfortable providing it. We're still having to do like provider education for PrEP, which I find crazy. Because I'm like, don't y'all have this whole system set up to disseminate research?
With all of the resources available.
It's kind of crazy to me. So the offering here too is just like, you have a cutting edge on medical professionals. Yes, I think that's probably the most appealing part for me, is just knowing that in response to all of this, it's like, yeah, but we're equipping our community.
I love that. I can't wait to hear more about this. How can people apply or ask questions about the program?
So you can reach out directly to me. My email is super easy. It's just amber@engagingarkansas.org. I will email you as well. I have an application. It's very short. It's not supposed to be exclusive in any way. Lived experience to the front of any variety, whether that's taking PrEP, living with HIV, sexual health experience, or you just want to help your folks. I will send that to you. It's available bilingually. So, yep, if you speak Spanish, I got that translated for y'all. And yeah, applications will be accepted until March 5th. And so it's kind of a short window. But again, the application is very short. I don't need references. I don't need a cover letter. You don't need to do any backbreaking. So it's a short window, but I feel confident about that. And then it'll be 2 virtual sessions next month and 2 in-person sessions.
That's great. So, yeah. That's a cool program. Like I said, I cannot wait to hear about it. Please let me know if there's anything I can do to support.
Yes.
We're wrapping up the episode, but I do want to ask you, is there anything that I didn't ask you that you wanted?
I don't know. I guess if I just re-speak to like healthcare apathy and medical distrust. To say you are correct, your anxiety is correct, you're actually not overreacting, and you've chosen to stay alive. So we do have to address the today. We have to address our bodies, our sexual health. So when it comes to feeling bad about talking to doctors and dealing with the system and the institution and them folks, whoever they are to you,
Right.
understand that I see you, I feel you, I hear you. It's not made up. You still are here. Like, we're here. This body is here. It can catch an infection at any time. You know, let's hold both. Let's hold both. You can't do nothing about them folks, really. You can't do nothing about 100 years of sterilizing our folks, you know, except stay alive,
Right.
persist. You know, you should go see the next 25 years of your life. Don't get caught up in a situation that we could have prevented, you know. So that's what I want to speak to. That I hear y'all, you're not lying, and I will never dismiss it. I'm also going to go ahead and call you in because we need to take care of this.
I absolutely love that. I have thoroughly enjoyed you on EAC Speaks. You definitely have to come back. It's an open invitation.
Thank you.
So please, 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 definitely reach out to Amber if you have any questions about the Prep Ambassador program. It's amber@engagingarkansas.org.
Mm-hmm.
Cool. I get that right.
Yeah.
Is there any final parting words? I won't say final, I'll say parting for this time that you would like to leave with people.
I think I did. If I did, I'll get to talking too long. And let me know if you're in prep, you know, as always. Yeah, I can get you on prep. I can tell you about prep. I can tell your friends about prep.
And if you need somebody to come to your school or to your event.
I do love youth. I love youth. I'm waiting on juvenile detention, actually, to let us know if we can educate and test. I love youth, troubled youth.
I love that. We have to
Y'all
have
trouble,
a
but you know.
conversation offline. Let's talk offline soon. But yes, thank you again for coming on EAC Speaks. This was absolutely fabulous. Please reach out to Amber if you do have any questions about prep, the program, or anything, because it seems like you have good resources. I need to get your list. All right. And if you are out there and you would like to be a guest on EAC Speaks, please do not hesitate to reach out to us. We are on most of the socials. You can reach out to us on the website and then follow me too. Dang, this week. All right. Say ciao, Amber.
Ciao.
The EAC Speaks podcast is partially supported by the Arkansas Department of Health through a grant funded in part by the CDC. All discussion is solely the responsibility of each participant and doesn't necessarily represent the official views of Engaging Arkansas Communities, the Arkansas Department of Health, CDC, or the U.S. government.